Slim Chickens is the proud kitchen sponsor for New Mexico Living.
Are you leaving benefits on the table? Medicare's annual enrollment period is now through December 7th, and millions of people with both Medicare and Medicaid may be missing out on valuable extra support. So joining us now to discuss how a dual special needs or DSNP plan may help people get support to live healthier is Maya Stefanovic from UnitedHealthcare. Maya, thank you for being here today.
Thank you for having me.
This is a very important conversation that we're talking about. Open enrollment is currently underway, and we do not want people to miss this window and not have the coverage they need. So today we're talking about DSNP plans. Millions of people probably qualify but are not enrolled. Can you talk to me about who is eligible for these plans and why right now is the time to act?
Yes, certainly. So if you or a loved one has Medicare or and Medicaid, you may be eligible for a dual special needs plan, which we call DSNP.
Okay.
And what's important is the timing, because right now open enrollment starts from now until December 7th.
Right.
So it's time to go explore your options and find out if you're eligible. And as you said, only about half of people that are eligible are signed up for these dual special needs plans.
So people are missing out on some good coverage benefits, right? Many may just
Exactly.
not know that they qualify. So talking to a professional really can help walk you through the process. How can these DSNP plans work to simplify coverage, maybe help lower costs as well?
So these DSNP plans help manage both of your Medicare and Medicaid benefits. And so it helps you organize how you use your coverage. And in doing that, it helps you lower your out-of-pocket costs. And most people that are eligible for these plans are managing at least one chronic condition, like diabetes or heart disease. And so it helps coordinate the care around these in 4 important ways. One is tracking like your provider visits, making sure you coordinate those. Another might be supporting your medication needs. A third way could be connecting you to important social support services like caregiver services or housing. And a fourth is really just helping you stay current on your preventive care.
All important things, right? Everything matters when it comes to the coverage that you have, and it's not one size fits all. Some things are different for different people. But at the end of the day, too, lowering those costs is a beautiful thing. We're all trying to stretch our dollar a little bit farther these days. What extra benefits and everyday support can people access through DSNP plans?
So this is where these plans really make a difference. You get Medicare drug coverage, and you could be getting other benefits around vision, hearing, dental. In New Mexico, only about 61% of people said they visited a dentist in the last year, which is really low compared to other states. So you can also may be eligible for benefits like getting rides to your provider visit or the grocery store or your pharmacy to pick up your meds. So that's an important transportation, is an important benefit. You can also get help purchasing over-the-counter medications such as like aspirin or allergy pills, vitamins. And then a fourth, many DSNP plans offer additional benefits for folks that are managing that chronic condition. An example would be you might be managing diabetes and you need to have a refrigerator for your insulin, and so you might get help with your utility costs. Or maybe you need some help with healthy food boxes, so it could help with some of those grocery costs.
That's incredible to realize that these plans have those extra benefits that aren't just maybe specifically medical related, but it's the other things that can help you access the medical care you need. Those rides, those refrigerators for the insulin if you are a diabetic. Incredible resources to have. We have talked about a lot today. I'm sure our viewers are like, maybe there's a website or a place where I can go read through everything. Is there a website we can visit?
Definitely. So if you have Medicaid or Medicare and you want to learn more about your options, you should visit getdual.com, and that's GETDUAL.com. And make sure you do this now or very soon, because the open enrollment period, like I said, ends December 7th.
It ends December 7th, a really important conversation we just had. Thank you so much for coming in and sharing all that information. Guys, don't miss this window. Get the health care that you need. Maya, thank you for being here today.
Thank you so much for having me.
Guys, stay with us. We'll be right back.